Hello, my name's Gwyneth Hinds. I'm a retired doctor. I'm now working as a Pilates teacher. And over the last number of years, I've become more involved in helping support and educate and empower women who are going through the menopause. So today we're going to talk about loss of libido, what it is, why it happens, how does the menopause come into the whole story, and then more importantly, what we can do about it. So when we talk about libido, we're talking about sex drive. And when you think about it, that's something that is up and down throughout our lives at different times. And it's got a lot to do with a lot of other things that are happening in our life, not just hormone levels. If you're thinking about a new relationship, well, then sex drive can be really on all, firing on all cylinders. And as time goes on, we're in relationships for many years, yeah, maybe things are just sort of slowing down. And you know something, that is fine. It is not a problem. And the other thing is it's not all about us. It's about the person that we're with as well. But it is an important part of our well-being. And if it's something that is a problem for you and it's something that you feel as if you're missing out and your relationship is suffering and your well-being is suffering because of your lack of sex drive, then it is something that needs to be looked at and treated appropriately. When we come to the menopause, things can get a little bit more difficult for lots of different reasons. And when we look at some studies, maybe about 1 in 5 women would say that they're having problems and that they notice that their sex drive is much lower at the time of menopause. But then for a lot of other women, it isn't a problem at all. And actually, for some women, the fact that they no longer have to think about contraception and no longer having periods, actually the kids may have moved out or they're out in the night, actually it's helping the relationship and things are actually then improving. So when we're thinking about what are the causes of it, we do have to think about that relationship first of all. And communication is so important. And talking to your partner, talking about how you feel, acknowledging that things have changed, that certainly as we get older and again at the menopause, we may find that just things take a little bit longer to get started. If we think about sex and how it was almost like just turning on a light switch in the room and things would just move into action, maybe there just needs to be a little bit more care and attention just to get us in the mood, and it's maybe a little bit of a slow burn, and that actually might be quite good and quite good fun. But we need to communicate with our partner so that we understand what's happening for both of us. You know, the other thing is that think about how you feel about yourself. As we get older and we notice the wrinkles and we notice the grey hair and the sagginess, and you know, we sometimes can let things go a bit and we actually don't hold ourselves in the same esteem as what we did when we were younger. You know, if you're going to bed at night in that old baggy t-shirt, well, it's probably not the greatest turn on. And that is about you as well. If you actually think about yourself and see yourself as attractive, then you are going to be much more in the mood for a relationship and getting close and intimate with your partner. So those are some of the things to think about. Again, life is busy. You might have children, you might have a high pressure job. Look at your levels of stress. And then if that stress is a problem, well, then you do need to set more time aside so that you can relax with your partner. If we also then think about fatigue, and that again is probably one of the most common symptoms that women will complain about in menopause. And it doesn't seem just to be due to the hot flushes and night sweats. It does seem to be something in itself as well. So if we are fatigued, if we're having hot flushes and night sweats, well, then again, that's not going to help us feel in top form or empowered in any aspect of our life. So lots of women do find that HRT helps with those hot flushes and night sweats and helping to our fatigue. And that's probably one of those first things to think about. So that's one side of what happens at the menopause. Then the other thing is that the changes that a lot of women notice down below. We talk about vaginal atrophy, where the lack of estrogen makes big changes in the lining of the vagina and can then cause soreness and pain during intercourse. And again, that's something that needs to be put right. But we're actually going to come back to that in another video. So I'm actually going to park that for the moment. So there are those things, but then when we think about the sex drive, yes, there are some women who will find that their sex drive will be lower at the time of the menopause. And the first thing to think about is about estrogen replacement. Now, I haven't mentioned anything about testosterone yet, but we're going to come to that. But the most important thing is actually the estrogen. So if we're starting on estrogen, and sort of an average dose would be about 50 microgram patch, okay? But if you're really finding that low sex drive is a problem, it's worthwhile talking to your GP, and they may well consider increasing it to a slightly higher dose. Now, I'm not talking about doses outside the prescribed limits, but the higher range rather than the sort of the mid-range. The other thing is that you may be aware that whenever we use transdermal estrogens that are absorbed through the skin, whether it be a patch, gel, or spray, that it's metabolized differently than if we take it in tablet form. And if we take our estrogen in tablet form, it actually could increase the level of a sex-binding protein in our blood, which holds on to more testosterone, and therefore there would be less testosterone available to travel around the body. So for that reason, we may find that changing from an oral form to a transdermal form of HRT and increasing the dose is sufficient to actually help increase our sex drive. Now, all of these things are going to take time, so don't expect for an overnight success. It's the sort of thing that, you know, it's in progress. You really need to give yourself a bit of time. Think about those lifestyle factors. You know, think about you know, your relationship and build on it, as well as maybe giving the higher dose of transdermal estrogen maybe about 3 months before you see the impact of it. Pelvic floor and as well, and that obviously links in the sort of with urinary incontinence. And again, we're going to come back to that. But also, if we have a good, strong, active, healthy pelvic floor, that's also going to help us with the arousal during sex. So if you think everything's a bit saggy there, you know, even the lack of blood supply is going to mean that things are not just going to be as responsive as they were in the past. So we do need to think about the pelvic floor as well, because obviously we know that when estrogen levels fall, that the tone in the pelvic floor changes. Things just become a little bit more saggy. The tissues around the clitoris and even the size of the clitoris change. The blood supply is not as good, and the muscle tone's not as good. So this is where exercise is actually really important. And there is there is research that shows that any exercise will actually help to improve our sex drive. And that's not just to do with the pelvic floor, also the endorphins. I'm a Pilates teacher, so I'm always focusing on core muscles and the pelvic floor strength. And I think that is certainly one of the things that is really useful. And there's more and more evidence now that whenever we're thinking about exercises for the pelvic floor, that we shouldn't necessarily just target the pelvic floor, but we need to think about total body exercise. And again, exercise on a regular basis is going to help us feel better about ourselves and can also boost sex drive. So then let's think about testosterone. So we know that for men and women that testosterone is at the highest level in about their 30s. And then after that, there's a slow and steady decline for both men and women. That at the menopause, there isn't that sudden drop the way there would be with estrogen. And that's because that the ovaries continue to produce testosterone even after the menopause, even up for about another 20 years, that there's still testosterone being produced. Testosterone is also produced by the adrenal gland, which is a small gland, which is to do with our stress and hormones and even our fatty tissue. Now, the one area where this is maybe more important are for young women who have had their ovaries removed surgically. And this is something I dealt with quite a bit whenever I was in practice, dealing with young women who had their ovaries removed because they were at high risk of ovarian cancer. And when I saw these girls in the clinic, they were saying, I just feel awful. And they were on their HRT, but they were having profound fatigue, and they noticed that their sex drive had just disappeared. It wasn't as if it had just gone down a little. It was very dramatic, And when I heard them talk about it, it definitely appeared to me that this was on a very different level than a lot of other women. And those were women that definitely did benefit from the testosterone. So testosterone can boost sex drive, but it may not have as dramatic effect for women who still have their ovaries. It might be part of the jigsaw puzzle, but it's not going to be the only factor. So I hope that this has maybe given you a little bit more to think about. So what I would like you to think about, first of all, is think about your relationship. Talk to your partner. It's not going to be easy, but maybe having had this video today gives you that opening for that conversation. Talk to your GP, make sure you're getting adequate estrogen, see how things are going. And then certainly it may be something that your GP may consider then thinking about adding in testosterone.